Your cat could be crying for help right now, and you'd never know. Vets warn that 90% of cats hide their pain until it's too late. They don't whimper. They don't cry. Instead, they give off silent, bizarre signals most owners mistake for quirks. A cat licking its lips obsessively, kidney failure, sudden aggression, excruciating joint pain. That cute slow blink could be a neurological SOS. In this video, we reveal 20 hidden signs your cat is suffering, and some of them look like nothing at first. Number 7 will shock you, and if you see number 18, rush to the vet immediately. Let's get into it, before it's too late. 1. Hiding more than usual. Cats love cozy hideouts, sure. But if your social or semi-social cat suddenly becomes a ghost, avoiding you, hiding under beds, inside closets, or disappearing for hours, it's a huge red flag. This isn't shyness, it's pain, fear, or illness talking, and it needs your attention. 2. Sudden aggression or unusual fear. Your sweet lap cat hissing when touched, swatting when you approach, or acting spooked like they're seeing ghosts. Drastic personality shifts often signal internal distress, like joint pain, neurological issues, or trauma. They're not angry at you. They're crying out. 3. Not using the litter box. A healthy cat is clean and routine-based, so when they start peeing outside the box or pooping in corners, that's not bad behavior. It's a desperate message. It could mean urinary infections, kidney disease, or emotional stress. Don't punish, investigate. Change in appetite, suddenly eating. Too much or nothing at all is your cat turning their nose up at dinner, or suddenly scarfing down meals like they've never eaten before. Both are danger signs. Loss of appetite might indicate dental issues, nausea, or organ failure. Overeating might point to diabetes, thyroid imbalance, or even depression. 5. Excessive grooming, or no grooming at all. A healthy cat grooms daily. It's their way of staying sane. But if your cat starts licking obsessively, especially one spot, it could be allergies, pain, or even anxiety. On the flip side, if they've stopped grooming and their fur looks oily, dull, or matted, they could be too sick to care. 6. Strange vocalizations. You've never heard before. You know your cat's regular meow, but if they suddenly start howling, yowling, chirping, or making eerie nighttime cries, it's not random. Some cats cry when they're in pain. Others call out when they're disoriented, lonely, or going blind. When the sounds change, pay close attention. 7. Weight loss or weight gain, with no diet. Changes cats don't drastically gain or lose weight without a reason. Weight loss could mean cancer, diabetes, or worms. Sudden weight gain may indicate thyroid issues or fluid retention. Either way, it's not just aging. It's urgent. 8. Lethargy or low energy. If your playful, curious kitty is suddenly acting like a sluggish couch potato, don't write it off. Cats naturally nap a lot, but constant fatigue, lack of interest in toys, or sleeping in weird spots can signal fever, heart issues, or pain that's wearing them down. 9. Vomiting, even just occasionally. Many cat parents shrug off occasional vomiting. But here's the truth. It's not normal. Hairballs once in a while, okay. But regular puking, even once a week, can mean gastritis, food intolerance, or kidney disease. And chronic vomiting is never okay. 10. Breathing issues or rapid panting. Is your cat breathing heavily with their mouth open or panting like a dog? That's not cooling off. It's an emergency. Respiratory distress, heart failure, or fluid buildup in the lungs can all cause labored breathing. If this happens, you don't wait. You run to the vet. 11th. A sudden change in eye appearance. Dilated pupils for no reason. Bloodshot eyes. One eye squinting more than the other. Eye changes can mean infection, injury, or even high blood pressure. In older cats, it can even hint at blindness setting in. Their eyes speak volumes. Listen. 12. Sudden limping or unusual posture. If your cat starts limping, walking stiffly, or suddenly sitting hunched with their legs tucked oddly, that's not laziness. It might be arthritis, injury, or neurological issues. Pain changes how your cat moves, stands, and even sleeps, and it's heartbreaking once you notice it. 13. Constant pawing at the mouth or shaking their head. You might think they're just being quirky, but these are often signs of dental pain, abscesses, or even something lodged in their mouth or throat. If it keeps happening, it's your cue to check their gums and call your vet. 14. Bad breath. That smells like rotten fish or chemicals. Yes, your cat's breath won't smell like roses, but if it's foul, something's off. Rotten or metallic breath often signals advanced dental disease, kidney failure, or digestive issues. That smell. It's a cry for help.
15. Constant meowing or following you everywhere restlessly. This isn't just clinginess. When your cat suddenly becomes a loud shadow, meowing persistently, pacing, or acting restless, they might be anxious, disoriented, or in distress. Elderly cats especially do this when cognitive issues like dementia set in. 16. Tail twitching or skin rippling randomly. Does your cat's skin ripple or their tail twitch when they're just lying down? It might be feline hyperesthesia syndrome, an actual neurological condition that causes discomfort, pain, and odd behavior. Don't laugh it off. This one needs a vet's eye. 17. Drinking too much water, or not at all. Has your cat suddenly become obsessed with their water bowl, or have they stopped drinking entirely? Excessive drinking often points to diabetes or kidney disease. Not drinking at all is just as dangerous, leading to dehydration and worse. 18. Struggling to jump or climb. Cats are natural ninjas. When yours starts hesitating before jumping on the bed, or stops climbing to their favorite perch, it's usually not laziness. Arthritis, joint issues, or pain in the spine or legs might be holding them back. 19. Sudden litter box accidents, especially peeing outside the box. Yes, we mentioned this earlier, but this one's so serious, it bears repeating. If your cat is straining to pee, going in small amounts, or crying in the litter box, it could mean a urinary blockage, especially in males. This can kill your cat in 48 hours. No joke. If you see this, go to the vet immediately. 20. You just feel something's off. This last one is harder to define, but the most powerful. As a cat parent, you know your cat. And if something deep inside you feels like they're not okay, trust that gut feeling. The subtle shifts, the way they look at you, how they respond to your touch, where they sleep, it all matters. Instinct isn't just for animals. So, Wildeca family, how many of these signs have you seen before and brushed off? If even one of them hit close to home, now's the time to act. Don't wait until it's too late. Schedule a vet checkup, observe your cat closely, and most of all, listen to what they're trying to say. Because sometimes, the quietest creatures scream the loudest, if we just know how to hear them. If this video helped you understand your cat better, hit the like button. It tells us to keep creating more life-saving content. And if you love your cat like family, subscribe to Wildeca for weekly videos that keep your pet happy, healthy, and safe. Let us know in the comments if you've ever spotted one of these signs, and what it turned out to be. Your story might save someone else's cat. Until next time, stay wild, stay curious, and keep loving your feline friends with all your heart.